Hello, my name is Wilson Ramos, and today I'm going to talk about Pyoderma Gangrenosum in ulcerative colitis. Definition: Pyoderma gangrenosum is a rare ulcerative skin disease, part of a spectrum of neurophysical and autoinflammatory dermatosis. Its pathogenesis is unknown, although immunopathogenesis pathways have been implicated. Lesion biopsies show a predominantly neurotypical inflated. The incidence of Pyoderma gangrenosum is uncertain, but it is estimated to be a 3 to 10 per million per year, occurring at any age but most commonly between 20 and 50 years, with a possible slightly higher incidence in women. Approximately 50% of patients with Pyoderma gangrenosum also have another disease associated with Pyoderma gangrenosum. The most common is inflammatory bowel disease, particularly Crohn's and ulcerative colitis.
Pyoderma gangrenosum. Pyoderma gangrenosum is a neutrophilic dermatosis that presents as an ulcerative skin disease. It starts as an inflammatory papule or pustule and may progress to become a vesicle or a nodule and can eventually form an expanding purulent ulcer. Pyoderma gangrenosum can present as a single or multiple lesions, usually on the trunk or lower extremities. It is most commonly triggered by a local trauma due to pathergy, neutrophil dysfunction, and dysregulation of the immune system due to an underlying systemic inflammation are major contributors towards pathogenesis of Pyoderma gangrenosum. At least half of the patients with Pyoderma gangrenosum have an associated underlying systemic disorder, such as an inflammatory bowel disease, or arthropathies, or solid organ malignant conditions, or hematologic malignant neoplasms like acute myeloid leukemia or other hematological conditions like myelodysplastic syndrome. Pyoderma gangrenosum is diagnosed based on histologic criteria and history and clinical exam findings along with treatment findings. The major criterion is biopsy of the ulcer edge demonstrating a neutrophilic infiltrate. The minor criteria include an exclusion of infection, pathergy positive, personal history of inflammatory bowel disease or inflammatory arthritis, history of a papule or pustule or vesicle that rapidly ulcerated, peripheral erythema, undermining border and tenderness at the site of ulceration, multiple ulcerations with at least one occurring on an anterior lower leg, and cribriform or wrinkled paper scars at the site of healed ulcers, and decrease in ulcer size with 1 month of initiating immunosuppressive medications. Treatment typically requires local corticosteroid or calcineurin inhibitors for limited disease and systemic corticosteroids or cyclosporine for widespread or rapidly progressive disease.
Now we go to application in medicine. In medicine, the treatment of Pyoderma gangrenosum is mainly non-surgical. The necrotic tissue should be gently removed, while surgical debridement should be avoided during the active stage of Pyoderma gangrenosum because it may result in enlargement of the ulcer. Skin grafting and other surgical procedures might be performed when the active disease please has settled, with care to minimize trauma. Often conventional antibiotics such as flucloxacillin are prescribed before making the correct diagnosis. This may be continued if bacteria are cultured in the wound of their surrounding cellulitis, but they are not helpful for uncomplicated pyoderma gangrenosum. Who had small ulcers are often treated with potassium topical steroid ointment, tacrolimus ointment, intralesional steroid injection into ulcer edge, cyclosporin solution, oral anti-inflammatory antibiotics such as doxycycline and minocycline, and large ulcer systematic treatment of large ulcers due to Pyoderma Gangrenosum might include oral prednisone for several weeks or longer or aiming intravenous methylprednisone for 3 to 5 years. Cyclosporin, which is as effective as prednisone and is defining advised effects and risk. Biologic agents such as with infliximab, adalimumab, entasermab, and ustekinumab is reported in a small number of cases.
We've shown you photos of some extreme medical conditions over the years, and today we have some of our most shocking yet. It's time for What Is This? What Happened? And Could It Happen to Me? So let's start with this picture. And as you all try to figure out what happened and could it happen to you, Dr. Batra, what did happen?
So this is actually a very zoomed in picture, and I think if you go back, you'll actually see the part of the normal skin on the breast. This is a condition that's really quite rare. It's called Pyoderma Gangrenosum, and it's a condition where when you have an injury to your skin, in this case, the picture is taken from a woman whose photo went viral. She was scratched by a cat. But what happens is all of these inflammatory cells rush to try and heal the injury, but they get stuck, and they're an overabundance of cells called neutrophils. And the way I always kind of think of this in my mind is like when there's an accident and all the bystanders are in the front lines, that the first responders can't get there and actually fix the problem. That's what's happening here. You actually have all of these inflammatory cells that are not meant to be there crowding out the actual wound healing that's meant to occur. So anytime someone gets an injury, it just becomes this horrible, painful, non-healing ulcer. And this is actually really challenging to diagnose because you have to rule out all sorts of infectious causes and other possible reasons for this. You have to diagnose this on biopsy. It's much more common in people with other autoimmune conditions or certainly inflammatory bowel disease. And it's treated by very long courses of anti-inflammatories. So sometimes we were just talking about a couple of cases of mine in my clinic where it's taken months to years of long-term steroids or anti-inflammatories to actually make this get better, and does heal with pretty significant scarring as well.
So having the diagnosis of an autoimmune disease really helps you pinpoint that it's probably that, right?
Absolutely, but dermatologists always consider this sort of a diagnosis of exclusion because you can't just assume they have this horrible, painful ulcer. Just because of this, you're going to end up having to rule out other sources of infection, and pretty much it's a dual-edged sword. When you do the biopsy, sometimes the biopsy doesn't heal either.
Really?
So challenging, wow. Yeah.
The pros and cons.
I've had Pyoderma Gangrenosum for 10 years and 1 month. I was treated for venous ulcers for 5 of those years. That involved triple layer bandaging, being told not to get the ulcers wet, and the surgeon wanting to remove my non-existent varicose veins.
Pyoderma gangrenosum is a rare and very painful skin condition that causes rapidly spreading ulcers on the skin. It's an autoimmune condition that's also associated with other autoimmune conditions such as rheumatoid arthritis.
I decided to do the stopgap trial in the hope of finding a cure or a standardised treatment. I don't want anyone else going through what I've been through. I want patients who have this condition to be diagnosed promptly and given the help we deserve.
Pyoderma gangrenosum can sometimes be treated with topical medications such as potent or superpotent topical corticosteroids, but usually systemic therapies are required. And the 2 most commonly used systemic treatments are oral prednisolone, which is a steroid medication, or cyclosporin, which is a drug that affects the immune system. And we wanted to compare these 2 most commonly used systemic therapies head-to-head in the stopgap trial. Doctors and patients can choose either of these treatments, safe in the knowledge that whichever they choose is likely to have similar benefit, and they can choose one that suits their own preferences or their other comorbidities that patients might have. Our big surprise really was that neither medication worked terribly well. After 6 months, less than half of the patients' ulcers had healed, and in those who did heal, 1 in 3 had a repeat attack. So this suggests that we urgently need new treatments for Pyoderma gangrenosum.
It's the pain that interferes with my daily life the most. It has driven me and my partner to the brink of insanity. It's the knowing that every time you reposition yourself, or if you need to get up, you're going to be in the most awful pain. I also get sudden nerve pain in my legs, and it's enough to make me yelp. It puts me off moving. On bad days I stay in bed, only getting up for comfort breaks and to take more medication.
The stopgap trial helped to raise awareness of this painful and debilitating condition, which is often misdiagnosed. These results are now being widely disseminated amongst many healthcare professionals, and patients themselves have been encouraged to take along the results of the study to share with their healthcare professionals. So for the first time, it means that patients and doctors can use this best quality evidence to make informed decisions about what's best for them.
The pros has the treatment with corticosteroids aims to prevent progression and rapidly stop inflammation. Infliximab can be continued with ASA. Patients with UCA treated with infliximab plus ASA were more likely to achieve corticosteroid-free remission at 16 weeks than those receiving either monotherapy. And in the cons, side effects might be fluid retention causing swelling in your lower leg, high blood pressure, problem with mood swings, memory, behavior, and other psychological effects such as confusion or delirium, upset stomach. Issues apply in Ecuador. There is no report of specific cases and controls in Ecuador, but it has been shown that the provinces of Guayas and Pichincha were the ones that report the most cases of ulcerative colitis in Ecuador. Conclusions. People with Pyoderma gangrenosum associated with ulcerative colitis must maintain a lifestyle different from the common society. This disease alone is already big a problem for patients that can be lead to death. Therefore, on any suspicion of gastrointestinal disease, it is advisable to go to health professionals. Thank you.